Bismillahirrahmanirrahim. Today we talk about the carcinoid tumors. The carcinoid tumors are also known as the neuroendocrine cell tumors because they appear in the neuroendocrine cells. So what is a neuroendocrine cell? A neuroendocrine cell is the one which is stimulated by the nerve impulses, by the neurotransmitters, and in response it gives rise to the secretion of various endocrine hormones. And these endocrine hormones have various effects in the body. These neuroendocrine cells, when they become tumorous and cancerous, what happens that they will cause excess secretion of various hormones that are secreted by the neuroendocrine cells. Normally, the secretion of these hormones is under the control of other hormones or nerve impulses, and in this way a regulated secretion of the hormones by the neuroendocrine cells occur as much as that is required by the body for various functions. Here we talk about particularly the neuroendocrine cells and neuroendocrine tumors that occur in the neuroendocrine cells that are located in the gastrointestinal tract. So various neuroendocrine cells are located in the stomach, small and large intestine, in the pancreas, and they are stimulated by the various nerve impulses and they cause secretion of various hormones. Particularly if we talk about specially of the neuroendocrine cells that are located in the gastrointestinal tract. So these neuroendocrine cells, they secrete the serotonin. Serotonin normally controls the gut motility, and the excess secretion of serotonin that is seen in the carcinoid tumors will cause increased gastrointestinal motility and peristalsis, and it may result in diarrhea. The same serotonin has its effect in the lungs where it causes constriction of the bronchioles. So bronchoconstriction will cause shortness of breath, difficulty in breathing, and the wheezing. That is a common symptom seen during bronchoconstriction. Various hormones secreted by the neuroendocrine cell include the bradykinins, which is a component of the kinase system, and the prostaglandins. And they are strong vasodilators. They cause vasodilation and increase blood flow. And this increased blood flow appears in the form of the flushing, which is redness due to increased blood flow, and that is particularly seen on the face and facial regions. So collectively these symptoms and these effects, which are caused by the excess secretion of the hormones by the malignant neuroendocrine cells, they make the carcinoid syndrome. So carcinoid tumors appear in the neuroendocrine cells, and various hormones secreted in excess in carcinoid tumor, they will cause various effects and symptoms, and they constitute the carcinoid syndrome. The neuroendocrine cells, normally they are strictly regulated by the nerve impulses and other hormones. For example, the somatostatin, which is a component of the growth hormone system, and it is secreted by the hypothalamus to suppress the secretion of growth hormone from the anterior pituitary. But here in the stomach, this somatostatin is secreted by the D cells, and these delta cells in the stomach secrete somatostatin, and this somatostatin will inhibit the secretion of the various hormones from the neuroendocrine cells, and uh, it provides a control mechanism so that only the required hormones are secreted, and the somatostatin generally it will inhibit the secretion of hormones not only in the neuroendocrine cells located in the stomach but also in the rest of the gastrointestinal tract. Now, as I mentioned, that the neuroendocrine cells, neuroendocrine. Neuro means they are stimulated by the nerve impulses by the neurotransmitters, and endocrine means they will, in response, secrete various hormones. Neuroendocrine cells are located throughout the body, and they are located in the pancreas, they are located in the stomach, small intestine, large intestine, and in the ovaries of the female, and in the testicular tissue in the male, and also in infants they are located in the thymus. Upon nerve stimulations, these neuroendocrine cells secrete various hormones. For example, the neuroendocrine cells secrete amines, which include serotonin and histamine. Serotonin has its effects on the gastrointestinal tract. It increases the motility and peristalsis in the gastrointestinal tract, and so in case of carcinoid tumor, if there is excess secretion of the serotonin, it will cause diarrhea, which is a component of the carcinoid syndrome. The histamine is secreted by the enterochromaffin or E cells located in the stomach, and it will cause, along with gastrin, which is secreted by the G cells. So histamine and gastrin collectively they stimulate the parietal cells, which are located in the fundus and body of the stomach, to increase secretion of the hydrochloric acid. The gastrin secreted by the G cells, as along with histamine, it stimulates the parietal cells to increase the secretion of hydrochloric acid, are also located in the pancreas. And the tumors that arise in these G cells characterized by excess secretion of gastrin and which causes peptic ulcers is the Zollinger-Ellison syndrome. The polypeptides include the bradykinin, which is a component of the kinin system that we have discussed during inflammation, and this bradykinin itself, it causes vasodilation, and it has effect in flushing, the sign that is commonly seen in carcinoid syndrome, and which is characterized by the red appearance of the face and facial region, and which cause the flushing, and which is a sign that is seen in carcinoid syndrome. The polypeptides secreted by the neuroendocrine cells contains the important component of the kinin system known as the bradykinin, and it also causes vasodilation. The prostaglandins, which are actually arachidonic acid metabolites, and we have studied arachidonic acid metabolites and their role in inflammation. Arachidonic acid, which is derived from the linoleic acid, which is a phospholipid present in the cell membrane, is acted upon by the enzyme cyclooxygenase, and it will break down the arachidonic acid into prostaglandins and lipoxins. Particularly in the stomach, the arachidonic acid is broken down into the prostaglandins, and the component of the prostaglandins, an important member, is the PGI2, called the prostacyclin. And the prostacyclin, it causes vasodilation and inhibition of the platelet aggregations. So here we specially focus on the role of the prostaglandins and prostacyclin or PGI2, which causes vasodilation. And it may also be responsible for the flushing or red appearance of the face and facial regions, particularly when there is excess secretion of the prostaglandins in situations of the carcinoid tumors and carcinoid syndrome. So collectively, if we summarize the effects of the hormones secreted by the neuroendocrine cells, so we talk about the serotonin, which is an important component, and its excess secretion will cause certain symptoms. In the gastrointestinal tract, as I mentioned, that serotonin increases the motility and peristaltic contractions in the gastrointestinal tract, and it will result in diarrhea, which is a component of the carcinoid syndrome. Additionally, the serotonin has other effects, and particularly if we talk about the hemostasis and blood coagulation and tissue injury, this serotonin is used by the platelets. It is taken up by the platelets and it is used as a vasoconstrictor for the construction of the blood vessels that occur particularly after tissue injury. Another important role of serotonin, that serotonin in the connective tissue and particularly in the connective tissue of the heart, it will stimulate the fibroblasts to synthesize excess collagen. And the activation of the fibroblast brought about by the serotonin and the excess synthesis of the collagen in the cardiac tissue will cause thickening and rigid heart valves. Especially in the right side of the heart, the serotonin will cause fibroblast activation and increase collagen synthesis, and it will cause rigid and thickness of the tricuspid valve and pulmonary valve. In the tricuspid valve, it can cause tricuspid regurgitation, and in the pulmonary valve, it can cause pulmonary stenosis. As we know, the gastrin secreted by the G cells and the histamine secreted by the enterochromaffin cells in the stomach, they cause stimulation of the parietal cells located in the body and antrum and cause excess hydrochloric acid secretion by the parietal cells. We know that in the stomach various cells are located, and particularly the three major types of cells are the chief cells, parietal cells, and the mucus cells. The mucus cells, also known as foveolar cells, they secrete mucus. The chief cells, they secrete pepsinogen, which is acted upon by the HCl produced by the parietal cell and is converted into pepsin, which causes breakdown of the proteins into polypeptides. And these polypeptides are further broken down in the small intestine into component amino acids, and which are used by the various metabolic purposes in the body. But here we especially talk about the increased hydrochloric acid secretion by the parietal cells upon stimulation by the gastrin and histamine, which are secreted by the neuroendocrine cells, the G cells and the E cells. The neuroendocrine cells also secrete prostaglandins and bradykinins. Prostaglandins are arachidonic acid metabolites, particularly the prostacyclin or PGI2. It causes vasodilation, and the same vasodilation is also caused by the bradykinin, which is a component of the kinin system, and we have discussed their role in inflammation. The gastrin is secreted by the G cells and the G cells are also located in the pancreas. And the major function of the gastrin is to stimulate the parietal cells and to increase the secretion of hydrochloric acid. Sometimes tumors that occur in these G cells are known as gastrinomas. And these gastrinomas are neuroendocrine tumors, and they cause excess secretion of the gastrin and excess stimulation of the parietal cells and to secrete HCl, which may cause peptic ulcer, and this collection of symptoms is known as the Zollinger-Ellison syndrome. Now coming to the neuroendocrine tumors, as I mentioned that upon stimulation by the nerve impulses and neurotransmitters, the neuroendocrine cells located in the gut, particularly in the stomach, small intestine, large intestine, and pancreas. So those neuroendocrine cells that are located in the gut epithelium, they may become cancerous. So we know that why a cell become cancerous. The pathogenesis of the cancer involves genetic mutations. Normally in the cell cycle, the cell regulates the rules of the cell cycle, particularly if cell division is concerned. There are genes, and of which the tumor suppressor genes and proto-oncogenes are very important. The tumor suppressor genes, and of which the famous one is the P53, it checks the cells. If the cell has damaged DNA or mutated DNA, or if the cell carries genetic mutations, it will not allow the cell to divide. It will stimulate the DNA repairing program, and if the cell is repaired, so again it is allowed into the cell cycle to pass from the G phase into the M phase. But those cells with irreparable damage in the DNA and mutations, these cells then are supported, these cells are then uh, allowed to undergo apoptic cell death. But you think that if the tumor suppressor genes become mutated, so they will lose their control on the cell division, and in this situation mutated cells and cells with genetic mutations, they will undergo cell division, and the result is the formation of a tumor, and in this case in the neuroendocrine cells it will lead to the formation of the carcinoid tumor. In addition, in addition to tumor suppressor genes, there are proto-oncogenes which are converted into oncogenes, and they stimulate accelerated cell division. So whatsoever once the cells become mutated, and if the mutated cells start proliferation, it will form a large number of cancerous cells that will give rise to the formation of a tumor, and in this case we have the carcinoid tumor of the neuroendocrine cells. Now these neuroendocrine cells will be hyperactive, they will secrete excess hormones, and here as we know that the amines secreted by the neuroendocrine cells include serotonin, which has effects uh, in the gastrointestinal tract by causing diarrhea due to increased motility and peristaltic contractions of the gastrointestinal tract. The histamine, which in this case will stimulate the parietal cells to secrete excess hydrochloric acid. The polypeptide bradykinin, which is an important component of the kinase system, is a vasodilator, and the prostaglandins, which are arachidonic acid metabolites, and especially the prostacyclin or PGI2, is a vasodilator. So the symptoms that are produced by the excess secretion of these hormones from the carcinoid tumors and from the cancerous cells, they will cause symptoms like diarrhea, particularly caused by the serotonin, shortness of breath and wheezing, also caused by serotonin by its effect on the bronchioles where it causes bronchoconstriction, and the flushing effect which is caused by the polypeptides bradykinin and prostaglandins that cause increased vasodilation, and the face and facial regions of the patient becomes red. Here it is important to mention that carcinoid syndrome is a paraneoplastic syndrome. The paraneoplastic syndrome is a tumors or neoplasm associated syndromes in which the tumorous cells produce various hormones and various secretion and cause their effects in distant organs. Tumor is present in one organ and due to its secretion of various substances will cause symptoms and effects in other organs. So here we can say that carcinoid syndrome is a paraneoplastic syndrome. Now, if the carcinoid tumors are located in the stomach, for example, in the gastrointestinal tract, stomach, small intestine, duodenum, jejunum, and pancreas, and as we know that blood from these regions don't go directly into the heart, but this blood is taken up by the portal system and particular effect known as the first pass effect. So the excess secretions, the amines, prostaglandins, and bradykinins, so they are first taken by the blood and are carried into the liver. So what happens that we know that the liver is the metabolic machinery of the body and it will detoxify most of these hormones. And this is the case when the carcinoid tumors particularly occur in the pancreas and small intestine. And most of the carcinoid tumors, we can say more than 40% of the carcinoid tumors, they occur in the small intestine, duodenum, and jejunum. So the hormones secreted by these carcinoid tumors, they are carried into the liver, and a substantial portion of the hormones, it is detoxified by the liver, and therefore they do not produce symptoms. Here we particularly talk about the serotonin when it is taken by the portal blood into the liver. In the liver it is metabolized and converted into 5-hydroxyindole acetic acid. This 5-hydroxyindole acetic acid is excreted in the urine, and in this way it is eliminated from the body. But if there is so much excess production of the hormones by the tumor cells in carcinoid tumors, so it is not possible for the liver to detoxify the this bunch of the hormones. So at least 10% patients or less than 10% patients will develop carcinoid syndrome. And this carcinoid syndrome is caused by the excess hormones that are not detoxified in the liver, and they remain and stay in the circulation, and they can cause symptoms like cutaneous flushing, in which the face and facial region of the patient appears red due to vasodilation and increased blood flow. And as we know that this cutaneous flushing is particularly caused by the vasodilators, the prostaglandins, and the bradykinins. The same serotonin, it will cause bronchospasm, constriction of the bronchioles. Excess blood flow will also cause sweating. So bronchospasm, which is which occurs due to the effect of serotonins on the bronchioles and bronchi and causing constriction of the bronchioles and bronchi. It will cause difficulty in breathing, shortness of breath, and the wheezing effect or symptom that we commonly see in asthmatic patients. The serotonin, its effect on the gastrointestinal tract, it can cause colicky abdominal pain, diarrhea, and its effects on activating the fibroblast, which causes increased synthesis of the collagen, particularly in the right side of the heart, may cause thick and rigid heart valves. In particular, the tricuspid valve thickening, and when it becomes rigid, it can lead to tricuspid regurgitation. And in the pulmonary valve, the thickness and hardening of the pulmonary valve may result in pulmonary stenosis. So, summarizing the effects of the excess hormones secreted by the carcinoid tumors and the cancerous neuroendocrine cells include the histamine and bradykinin, which cause vasodilation that will result in flushing, the red color of the face, and the facial region, which has its specific appearance. We call it as flushing, and the histamine, which is secreted in excess, it can also cause itching, and the patient may complain of itching also too. Now, the excess serotonin will cause activation of the fibroblast and collagen synthesis, and it will lead to thickening, particularly in the heart valves, and that can lead to heart dysfunction. For example, if the tricuspid valve becomes thickened and rigid, it may result in tricuspid regurgitation. And in the pulmonary valve, the thickness and hardness of the uh, pulmonary valve becomes rigid, it may result in pulmonary stenosis. Serotonin in the lungs and its effects on the bronchi is to constrict the bronchi, the bronchoconstriction. And excess serotonin, if causes severe bronchoconstriction, it will lead to asthma, shortness of breath, and the wheezing sign. Here I want to mention that serotonin is actually formed from the tryptophan, which is an essential amino acid. But the same tryptophan also causes the formation of the nicotinic acid or vitamin B3 or niacin. So, when there is excess formation of the serotonin, the tryptophan available, most of the tryptophan will be used in the synthesis of serotonin, and very little amount will be left for the formation of niacin or vitamin B3. So what happens that in this situation a deficiency of the niacin or vitamin B3 occurs, and we know the deficiency of niacin or vitamin B3 will lead to the disease known as the pellagra. The pellagra is the disease which is characterized by the inflamed skin and sometimes mental confusion, and in carcinoid syndrome the underlying cause is that the available tryptophan is mostly used for the formation of serotonin, and little or no tryptophan is left for the formation of vitamin B3, which leads to vitamin B3 deficiency and pellagra. The gastrin, which is secreted by the G cells, and if these neuroendocrine G cells become cancerous, they will cause excess secretion of the gastrin and will cause gastrinoma. This type of tumor in the G cells is known as the gastrinoma. And the excess secretion of the gastrin will cause stimulation of the parietal cells to cause excess secretion of hydrochloric acid, and these symptoms they form the Zollinger-Ellison syndrome. Morphologically, the gross appearance in carcinoid tumors, these tumors often appear in the form of submucosal nodules or masses, which are composed of tumor cells, and these neuroendocrine tumor cells they appear embedded in a very dense fibrous tissue. Under the microscope, the neuroendocrine cells appears with dark spotted nuclei against a faint light colored cytoplasm, which gives the typical appearance of the salt and pepper pattern. So here we summarize the whole lecture, and we know that neuroendocrine cells tumors are known as the carcinoid tumors. The neuroendocrine cells are located in the stomach, small and large intestine, in the pancreas, and in the lungs. In the liver, the neurocarcinoid tumor may occur as a primary tumor, or it may result from metastasis from other area. But here important point that is to remember that if the carcinoid tumor is in the gastrointestinal tract or pancreas, the blood from those regions are carried through portal system into the liver, and most of the hormones they are detoxified. And very small percentage of patients will develop cancers, will develop symptoms. But if the tumor occurs in the liver, which may be primary, or if it has metastasized into the liver, that what happens that the liver itself becomes unable to detoxify the hormones. And here the carcinoid syndrome will be very prominent and with regarding to its effects. Generally, the carcinoid syndrome, carcinoid means carcinoma-like. Carcinoid tumors may be malignant, or sometimes they may be benign, and sometimes they may be malignant. Generally, the carcinoid tumors are slow growing tumors, and they have the potential of local invasion and distant metastasis. The carcinoid tumors in the gastrointestinal tract will lead to excess formation and secretion of the prostaglandins, which cause vasodilation. The important are the amines in which the histamine is involved, along with gastrin secreted by the G cells in stimulation of the parietal cells to cause excess secretion of HCl. And we know that serotonin, it will cause bronchoconstriction in the respiratory system, and it will lead to shortness of breath, difficulty in breathing, wheezing. And the serotonin, which is formed from the tryptophan, if the all available tryptophan, which is an essential amino acid that we should take in food, if all the tryptophan is used in the formation of serotonin, then little tryptophan is left to form the vitamin B3. And this decreased formation of the niacin or vitamin B3 will result in deficient and low levels in the blood, and its deficiency cause the disease pellagra, in which there is inflamed skin, and mental confusions and other neurological symptoms may appear. The symptoms produced by the hormones secreted by the neuroendocrine cancerous cells will lead to the formation of carcinoid syndrome. We know that serotonin is taken up to the liver, but this will be the case only when the tumor doesn't occur in the liver. When there is primary or secondary tumor in the liver, then the liver is unable to detoxify serotonin. But normally, serotonin, which is taken into the liver, it is converted into 5-hydroxyindole acetic acid, and 5-hydroxyindole acetic acid is excreted in urine, and in this way it is eliminated from the body. So when there is a carcinoid tumor, when there is excess formation of the serotonin, and it will be taken into the liver, and most of it will be converted and detoxified into 5-hydroxyindole acetic acid. And we can measure the level of the 5-hydroxyindole acetic acid in the urine, and it can give us an idea or information of the increased production of serotonin that will indicate a carcinoid tumor. The hormones polypeptides, bradykinin, which is a component of the kinase system, and the prostaglandins, which are arachidonic acid metabolites, they are responsible for the red color of the face known as the flushing, which is an important component of the carcinoid syndrome. So how do we diagnose carcinoid tumor? When we suspect, and if the patient appears with symptoms, for example, flushing, diarrhea, uh, and difficulty in breathing, shortness of breath, if patient comes with the symptoms of the carcinoid syndrome, and if we suspect that there is a carcinoid tumor in the gastrointestinal tract, what we do that we take an endoscope, introduce it into the gastrointestinal tract, and we can visualize the carcinoid tumors if they are located in the stomach and duodenum. Here we can also take a biopsy, and we send this biopsy for histopathological examination, and which will give us the presence of tumorous cells, and this histopathological evidence is must for making the diagnosis of carcinoid tumors to be confirmed. We can use ultrasound studies and computer tomography to evaluate the presence of metastasis in the lymph nodes and in other organs. And we can magnetic resonance resonant imaging can also help us in the evaluation of the disease, and a particular scan which is known as the octrio scan. We know that the somatostatin inhibits the secretion of the hormones from the neuroendocrine cells, and this somatostatin has got specific receptors on the neuroendocrine cells. So if we inject a radio-labeled somatostatin and inject it into the patient, this radio-labeled somatostatin will go and it will bind to the receptors on the neuroendocrine cells, and then through the octrio scan we can make images of the octrio scan, and we can see the presence of the radio-labeled somatostatin on the neuroendocrine cells through this imaging technique. For 5-hydroxyindole acetic acid, which is a metabolite of the serotonin in the liver and excreted in the urine, if we collect the urine of a patient for 24 hours, and if we measure the 5-hydroxyindole acetic acid, it will give us an information if it is more than the defined values, the standard values or the reference values, it will give us an information that there is excess production of the serotonin, and this may be due to a carcinoid tumor. As we know that serotonin, which is found from the tryptophan, and the niacin or vitamin B3 is also found from the tryptophan. But if there is excess production of serotonin, the substantial amount of tryptophan will be used for the formation of serotonin, and little will be left for the formation of the vitamin B3. And this will lead to the deficiency of the vitamin B3 in the blood, and it can cause the disease pellagra, characterized by the inflamed skin and mental confusion and other neurological manifestations. So we can also measure the level of the niacin in the blood to which will give us an idea of the excess formation of the serotonin. What we can do in carcinoid tumors, that we are supposed to stop the hormone production to get the patient relief from the symptoms. So as we know that somatostatin inhibits the secretion of the hormones from the neuroendocrine cells, we can use drugs known as the somatostatin analogs that have similar structure like somatostatin, and these drugs, they will go and they will bind to the receptors on the neuroendocrine cells, and like somatostatin, and they will inhibit the production of hormones and can give relief to the patient. Generally, the neuroendocrine tumors are carcinoid tumors that occur in the esophagus, stomach, and proximal part of the duodenum. They are comparatively innocent and rarely metastasize, and when surgically removed, they are cured. But the tumors that occur in the mid gut, the duodenum, jejunum, these tumors, they often are multiple, and they are very invasive, and these are very aggressive tumors with poor prognosis. On the other hand, if the carcinoid tumors in the appendix, it is totally innocent and benign because it is not aggressive and it doesn't cause metastasis. Similarly, the tumors that occur in the hindgut, in the distal portion of the transverse colon, descending colon, and rectum, comparatively they are innocent as compared to those that occur in the midgut or duodenum and jejunum. So the tumors in the hindgut also rarely metastasize. Here, one thing important that I want to mention, that alcohol consumption and emotional stress. These two things, the alcohol and the emotional stress, they stimulate the neuroendocrine cells through nerve impulses to increase the secretion of the hormones and to promote and facilitate the carcinoid syndrome. So we must advise the patient at least that as possible is to avoid the emotional stress and to quit alcohol, and this will give considerable relief of the symptoms that occur in the carcinoid syndrome. Thank you very much.